If you live and work in Mozambique, it's very important you have a good health insurance plan. The point about Mozambique is that although it's a beautiful country, the level of healthcare facilities are, shall we say, mixed. So for minor ailments or injuries, then basically you're going to be able to get treated locally, and that's not going to be a problem. But in the event of a more serious illness or a more serious accident, let's say a car accident, then most people are going to want to be evacuated. Everybody understands that Johannesburg is the place you're going to be evacuated to. It could also be Cape Town, but effectively you're going to want to be treated outside of Mozambique in a place where there's a first world level of healthcare facility. Not all insurance plans automatically conclude this or even have this option. Health insurance plans today are built in a fairly modular form. So it means that all health insurance plans will have an inpatient component that will cover you when you go into hospital. But there's also a number of options you can add on, and these would include things like outpatient, visits to the GP, medication, diagnostic testing, for example. The next module you might consider would be dental. The next module would be perhaps maternity. Maternity is critical if you're thinking of starting a family, because once again, not all health insurance plans automatically include maternity. And finally, and most importantly for Mozambique, is the evacuation option. Some insurers include this automatically, but not all. So make sure when you're buying a health insurance plan for living and working in Mozambique, you have this option. Today, there are many, many international insurers who can do this type of cover. AXA, Allianz, Cigna, Bupa, Aetna. The list is very long. There's also a large number of insurers that perhaps you've never heard of. These may be good insurers for you, but maybe you don't know about them. Our job as a health insurance intermediary is to help you find the right plan. Basically, we'll spend some time with you understanding your needs. We can then go away and assess the market and come back and present the right options and ultimately help you select the right plan. There's a tremendous amount of jargon and terminology in a health insurance plan, and we as experts spend all day reading these policies and talking with insurers to understand the correct interpretation of those rules and regulations and cover within the plan. So as an individual, trying to understand exactly how your plan will operate, particularly in an emergency, is very difficult. So if you need help or advice on health insurance and you live in or going to work in Mozambique, then please come and talk to us.